So hello everyone, I am Ray Kenneth Ligan and I will be discussing about prenatal checkup. So we are looking for the fundal height, the fetal heart tone, the expected date of delivery or expected date of confinement, and the age of gestation. Now we are going to define these following terms. Now fundal height, it is measured in centimeters from pubic symphysis up to the top of the uterus. So fetal heart tone, it ranges from 130 to 160 beats per minute in utero period. It is measured sonographically from 6 weeks, and normal range varies during gestation. So it increases up to around 170 beats per minute at 10 weeks and decreases up to 130 beats per minute at term. So, expected date of delivery, or also known as the expected date of confinement, it is a term that describes the date of delivery of a pregnant woman. So, normal pregnancy usually from 36 to 42 weeks. Now, AOG, or age of gestation, it is a commonly used term during pregnancy to describe how far along the pregnancy is. It is measured in weeks from first day of the woman's last menstrual cycle to the current date. So the purpose of having a prenatal checkup is to determine the expected date of delivery, to know the gestation and the growth of fetus if this is appropriate for its age of gestation, and of course to know the risk factors that could affect the progress of pregnancy and its outcome. And lastly, to provide health education and counseling and advice and preparation of childbirth. Now, this time, I am going to demonstrate the procedures and rationale during a prenatal checkup. Now, first thing that you need to do is to greet the client and explain the procedure. So this will help build rapport and it helps reduces anxiety. And of course, always provide the client's privacy. So this will help to preserve the dignity of the client. Now, second, you need to obtain the data from the first day of last menstrual period. So this will be your baseline or your reference to compute the EDD or the EDC.
Hi ma'am, so I am Ray Kenneth Ligan and I will be your nurse for today. Now, how are you feeling today ma'am?
I'm good.
Okay, that's good to hear. So when was your last menstrual cycle ma'am?
January 27, 2020.
Okay, thank you so much ma'am.
Now, after you interview your client, you have to compute the EDD or the EDC. So this will give information to your client on when is her expected date of delivery. Now, you are going to use the Nagel's rule. So our client for today is Jenny. So she is a first-time mom to be on this clinic for her prenatal visit. So upon interview, she said that her LMP is January 27, 2020. So we are going to use her LMP to measure the EDD and her AOG. Now we are going now to discuss Nagel's rule. Now the rule of Nagel's, we are going to add 7 days to the LMP and subtract 3 months to it. So you have to remember that months starting from January to March, you have to retain the year. Whilst from April to December, you have to add 1 year. Now these are the following days in a month. For you to remember it, you can use your knuckles to determine the number of days. So your knuckles is 31 days and the space in between is 30, except for February because it is 28 days and 29 in leap year. We are now going to compute the EDD of Jenny. So according to her, her LMP is January 27, 2020. Now January is 1, copy 27 and 2020. So we cannot subtract 3 in 1. That is why we make January as the 13th month of the year. So here is January as the 13th month of the year, February is 14th month, while March is 15th month of the year. We can subtract now 3 months to 13. So 13 minus 3 is 10. So 27 plus 7 is 34. So copy 2020 because as I have said, January to March, you have to retain the year. Now, 10 is the month of October. So October has only 31 days. So we have to subtract 31 days to 34. So 34 subtract 31 is 3. Now we have to add 1 month. So 10 plus 1 is 11. Now copy 2020. Now the EDD of Jenny is November 3, 2020. So next is age of gestation. Now this will determine on how many weeks or months the client is pregnant. Now compute AOG by continuing the number of days in a month starting from LMP up to the date. Now we are done computing the EDD. Now we are going to proceed to AOG or age of gestation to know how far along Jenny is pregnant. Now she said that her LMP is January 27, 2020. So the current date for today is October 26, 2020. Now we start from January. So we have 4 days here. Why? Because 27 is her last menstrual period and January has 31 days. So we have to subtract 27 to 31. So we have 4 days. Next is 29 days, 31 days, 30 days, 31 days, 30 days, 31 days, 31 days, 30 days, and 26 days. Now, we are going to add all the days starting from the LMP to the current date. So we have 273 days. Now divide it by 7 because the equivalent of 1 week is 7 days. So we have now 39 weeks. So the AOG of Jenny is 39 weeks. Now fundal height measurement. This is used to determine the growth and development of fetus inside the mother's womb. Now, you have to greet the client to help build rapport. And of course, explain the procedure, the indication, and the information that will be obtained. So this will reduce the anxiety and of course help foster the cooperation from the client.
So, hi ma'am, I am Roy Kenneth Ligan and I will be your nurse for today. So, how are you feeling today, ma'am?
I'm good.
Wow, that's nice. So today, ma'am, I will be doing a fundal height assessment. So this won't hurt and this won't take long, okay? Okay, now let's start.
Now the client should have voided within 30 minutes before the exam. Place the client in supine position with knees flexed. Promotes comfort and to have an accurate measurement because as distended bladder makes one's measurement inaccurate. Next is provide client's privacy. So uncover only the client's abdomen. This will preserve the client's dignity. Next is prepare the tape measure. So tape measure is more convenient equipment to use because it is flexible, thus will give an accurate measurement. Now before measuring the fundal height, you need to wash your hands to prevent transmission of microorganisms. So with warm hands, palpate the symphysis pubis. So warm hands promotes comfort. Now palpate the symphysis pubis. It is approximately located at the level of Mons pubis. Now after that, measure in centimeters the fundal height from the point of symphysis pubis to the uterine fundus. This will obtain an accurate computation on AOG or age of gestation. Now after that, you have to document the findings. for accountability purposes. Now lastly, you have to determine the fetal heart tone. Now proceed to Leopold's maneuver so that you will be able to determine the fetal position. Thus will help in locating the fetal heart tone. Now after determining the fetal back, place the bell of stethoscope and auscultate the fetal heart tone to identify the quality and quantity of fetal heart tone. To verify the heart tone, compare by obtaining maternal radial pulse while listening to the fetal heart tone. This will verify the accuracy of fetal heart tone. Now count the number of beats for 1 full minute to determine pulse rate. After that, document the data or findings for accountability purposes. So that is all. Thank you and goodbye.